When we look at different ethnicities, it's inherent in their genetic structure. If you go to Africa, Africa has the highest level of glaucoma anywhere in the world, and that's why you look at African Americans, and that's why we see such a high incidence and prevalence of glaucoma in that population. It's genetic, kind of like Tay-Sachs in the Jewish community. We have to also look at the Japanese community. For some reason, they have this unique kind of glaucoma. Why? Looks to be genetic. And so, how do we get it? Genetics. It just manifests itself in different populations differently.
As far as who gets glaucoma, older people, people of color, people of Asian descent, heavyset people, people taking a bunch of medicine for blood pressure and diabetes. They all get glaucoma at much higher rates than the general population.
There's about 40 different types of glaucoma. What differentiates them is what the underlying cause is. So there's different categories. We're going to end up treating them very similarly.
Glaucoma is a chronic progressive disease of the optic nerve, usually characterized by high intraocular pressure. Intraocular pressure is inside the eye. There's this fluid that's made by a structure in the body to give the eye nutrients, to keep the eye balanced. If it's made too quick and can't get out of the eye and is putting pressure on the blood vessels that's giving blood to the back of the nerve, the pressure builds up in the eye and the nerve starts choking, and that's called intraocular pressure.
The inside of our eye is filled with fluid, just like tires have air in them to hold their shape. Well, the fluid in our eye turns over about 4 times each day. So every day, the fluid in our eye is going to be generated and it needs to be removed. It needs to leave the eye. It's not part of our tears. It's all a system inside the eye. Well, when it turns over 4 times a day, we want a certain pressure in that eye, just like a certain pressure in the tire. When the pressure gets too high, it's like stepping on a garden hose. That blood vessel can't deliver blood. It's just a situation where we're getting too high a pressure in the eye and it's damaging the blood vessels and nerves and leading to vision loss.
Well, there are many tests that we could use to diagnose glaucoma. The most common is taking someone's pressure. But we've gone way beyond that because we know that glaucoma is not just pressure. It's a chronic disease that causes damage to the nerve inside the eye. So now we have new technology, which one is called OCT, which is a scan of the optic nerve to see if there's any damage to the little nerves that make up the big nerve. Then we also test the side vision of the patient. That's called the visual field. We know in glaucoma patients there are certain patterns where people will lose certain nerve fibers, and that is common. That's a common pattern that we'll see on the visual field testing, which is your side vision.
How do we diagnose it? Nowadays, we're going to diagnose it by, number one, obviously we're going to check pressure. Number two, there's a thing called OCT, which I like to explain, folks. It's kind of an MRI of your optic nerve. Number three is when you lose nerve function, you're going to lose visual function. So I'm going to start to miss my fingers out here. And so we check to see just, how much of your side vision are we losing? Because that's the one thing with glaucoma. People sit there and they go, should I just wait and come in when I start having loss of vision? The reality is, in glaucoma, by the time you realize that you've lost side vision, you've lost over half your optic nerve. Over half your optic nerve has died by the time you visually perceive it. The treatment options currently, we've got 3 different methodologies on how we're going to treat glaucoma. Number one is with pharmaceuticals. We're going to put drops in the eyes.
The primary treatment option in this country is eye drops. Eye drops designed to reduce the intraocular pressure, the fluid pressure in the eye. You have incisional surgery, invasive surgery, where you can put valves and filters in the eye. You have the pills, the carbonic anhydrase inhibitors that reduce the pressure in the eye, but most people can't take those long term. They have produced damage to your organ system. Drops are the number one treatment. Drops is the easiest thing to do. I don't want to say it's the most economical, but it's the easiest thing to do for most people with the lowest amount of risk, and that's why most eye doctors go to drops as first-line therapy.
And then lastly, what they've done more recently is they've gone in and used laser, and they take the ciliary body, which is going to produce the fluid, and they go in there and basically cauterize it and force it to produce less fluid. So we've got some surgical interventions, we've got some pharmaceutical interventions, and there's always questions about where you should start.
And that's variable.
Those are all those variables. Everybody thinks, oh, let's just get a surgical option and be done, but every time you do surgery, there's a risk of infection, and you're putting a permanent piece of something in your eye, and you can get inflammation in that area. You can get blood vessels growing all over it, and you know, surgery's not without consequences. Everything has its consequences and side effects. Can glaucoma be cured? The answer is really no. It's like high blood pressure. We can manage it. If we manage them, we're not going to have the devastating consequences. You don't manage high blood pressure, stroke is going to be in the books for you. If you don't manage glaucoma, blindness is going to be your consequence. And that's what we're trying to avoid. We can manage it, we can't cure it. 100% of those folks who have glaucoma who don't treat it go blind. Marijuana is not a very good option. I always tell folks that the impact that it has on lowering the pressure in your eye is minimal at best, negligible in most, and really not consequential in everyone.
SLT is a laser procedure that is used sometimes when pressure isn't controlled properly by the medications that we use. The surgeon will use a laser to put little holes in a structure inside the eye to help the fluid to get out quicker. But typically that isn't used until the medications aren't effective.
If you use SLT, you've got about a 2-year lifespan that it's going to work, and then it doesn't work anymore. And so you can go back a second time, but you can't go back a third time. They are using some stents. Depends on who you talk to. Stents is a small outflow. It's, you know, putting a little tube in there to help it outflow. Some people believe in them big time. Some folks don't believe in them big time. And there's not a lot of good data. And then there's the big filters, which are bad. I mean, infections are a constant problem. And so ophthalmology wants a surgical correction. They do. But it's not permanent. It's not as safe as they wanted you to believe it. But we also have the other side of that coin, and that's compliance. Putting drops in every day is a pain, and that's a hard part. But that's why I'm actually working with a company that I won't name at the moment. There's actually a way where we can inject in the eye a stent that releases a medication for glaucoma over 3 years, so that we can actually just increase compliance there. There's another company, Allergan, has actually developed a band that goes on your eye, under your upper and lower lids. You can't see it, can't feel it, you just leave it in there, and it delivers the drug for 30 days. And so just take that out, throw it away, put a new one on. And with that one, you probably have to come into the optometrist's office to have them put it in for you. And you just put it in once a month, and it stays there, and we don't have to worry about drops. So we're trying to address the compliance side. Is glaucoma covered by insurance? Absolutely, it's covered under your medical insurance. Vision plans don't cover this, but your medical insurance does cover it. Does lifestyle and exercise play a role? I like to think that exercise and just leading a healthy lifestyle helps everything. Currently, there's nothing we know that can prevent us from developing glaucoma. There's nothing out there yet. Doesn't mean we won't find something. We're always looking for things we can do preventively in everybody.
I have some patients ask me, Doc, how long am I going to have to do this? You know, is this something I'm going to do for a month, for a year? Is it going to get better? Is it going to get worse? You know, how long do I have to see you at this frequency, this intensity of service? And I tell them forever. I said, you have a disease that can blind you. If you have bad luck, or if you don't act right, or if I don't know what I'm doing, you might go blind, period. Do you want to go blind, yes or no? The answer is always no. I said, then please follow my instructions. I promise I'm not going to let you go blind if you do what I ask you to do. Is glaucoma preventable? I don't think so, not really. No. You can reduce your risk of developing glaucoma. Reducing your risk is primarily staying healthy. You got to stay healthy, you got to eat right, you can't be 50 to 100 pounds overweight. You can be 5 or 10 pounds, you don't have to be perfect. So the answer to me is no, you can't prevent it, But what you do is you work to reduce the risk factors so that you never develop it. Glaucoma medications have some pros and cons, and occasionally people that are having the cons will raise their hand and say something's not right. Most of the modern drops are safe. All of them are safe, pretty much. The most common drops, the prostaglandins, have 0 systemic side effects. It's a real high safety profile. The biggest thing on there is it might turn your eye red or make it burn or look funny, but it's not going to hurt you. Some of the other drops do have, again, some systemic side effects, so you've got to manage that. But generally speaking, it's not a big deal using drops. Is it possible to treat glaucoma through holistic means, through nutritional therapy, through improved physiological health, exercise, diet? Is that possible? I say no. There's nothing in the literature that suggests that, and nothing in my clinical experience suggests that. The answer is no. In a general sense, the healthier you are, the less likely you are to develop glaucoma. The healthier you are, if you have glaucoma, the less likely it is to progress. There's no acupuncture that I know that's going to fix glaucoma. There's none of that stuff's going to fix glaucoma. It's not going to go away. You're going to go blind if you don't treat it, period, okay? It's going to happen. It might take 10 years. It might take 20 years. But if you live longer than that, you're going to be blind.
Glaucoma is one of those disease entities that the earlier in the process that we can detect it, the better our outcomes. Just like with cancer, if you can find it very early, your outcomes are significantly better.
Glaucoma is perhaps the most devastating of these just because it's so common within our population. And really, patients aren't symptomatic for it until it's really at the end of the disease. The time to diagnose glaucoma is when it's very early in the disease, when only comprehensive eye exams, optical coherence tomography scans done at the optometry office, visual fields done at the optometry office are the only thing that is picking up the disease, not the patient being symptomatic. Because if you can treat at that point, the long-term outcomes are much, much better rather than waiting for the patient to be symptomatic.
So what can we do to prevent glaucoma? Well, there's some soft science, but there's science nevertheless to show that certain things decrease the risk of glaucoma. One is exercise. Exercise, as it's good for the whole body, is also good for the eyes. Vitamin C can decrease your risk of getting glaucoma up to 50%, some of the studies have shown us. Because it contains nitrates, green leafy vegetables can also help decrease the intraocular pressure. Meditation could decrease the risk of glaucoma. Thank you for watching Open Your Eyes. Be sure to tune in for more informative episodes.